In a world where a single vial of blood can reveal 1,000 secrets,
blood tests and diagnostics can be life-saving when used with clinical purpose.
should you hold on to those results like clues in a case file? The truth is, yes. Your past results are the missing pages in your health story. A silent revolution is unfolding in our pockets, on our wrists, even on our fingers.
This video is made for educational and informational purposes only.
In a world where a single vial of blood can reveal 1,000 secrets, most of us never question the quiet ritual we've grown accustomed to. Fasting nights, early morning lab visits, needles slipping beneath the skin as machines hum in the background. But behind the familiar smell of antiseptic and scribbled prescriptions lies a deeper mystery. Are these frequent blood tests and diagnostic scans truly necessary, or have we simply accepted them without understanding their purpose? This is where our story begins, in the shadowy intersection between modern medicine's brilliance and its growing reliance on data. For centuries, physicians had nothing but their instincts, observing a patient's breathing, complexion, and pulse with the precision of detectives. They inspected urine by sight alone, sometimes even by taste, searching for clues invisible to the untrained eye. But today, we live in a different era, one where machines peer inside us with surgical X-rays, where MRIs map the brain like a star chart, where a tiny drop of blood unravels secrets our ancestors could never dream of. And yet, in this landscape of extraordinary progress, many patients find themselves wondering if the sheer frequency of tests is truly about necessity or about a system that insists on seeing everything twice.
Blood tests and diagnostics can be life-saving when used with clinical purpose. They can help detect conditions like diabetes, kidney disease, and heart issues early, before clear symptoms appear.
But somewhere along the way, a question began rising. If your last test was normal, is it still relevant? Should you hold on to those results like clues in a case file? The truth is, yes. Your past results are the missing pages in your health story. A single test is only a snapshot, but a timeline reveals the plot.
Trends may reveal early signs of a problem or confirm that a one-time spike was simply a temporary variation.
Many doctors won't ask for your records, but hand them over anyway. You might be surprised how often they change the direction of your care, saving you time, money, and sometimes unnecessary worry. Yet here's the twist. Sometimes hospitals insist on repeating the very tests you just did elsewhere. Sometimes it's policy, sometimes it's caution, sometimes it's simply because they can't validate another lab's results. But in any case, you aren't powerless. Before that needle touches your skin, you can ask, can my previous results be used? Why is a repeat necessary? Can the reports be transferred? In this mystery, you're not the suspect, you're the investigator, gathering facts, questioning motives, protecting your health and your wallet. And while traditional diagnostics continue their reign, the story quietly shifts. A silent revolution is unfolding in our pockets, on our wrists, even on our fingers, wearable devices that monitor the body without a single drop of blood. What once required hospital machinery is now stitched into everyday life. Smartwatches capturing heart rhythms with clinical precision, rings tracking body temperature in the dead of night, patches decoding glucose levels in real time. These devices don't diagnose diseases, but they reveal patterns, anomalies, and warnings we once relied solely on doctors to detect. Apple Watch, Galaxy Watch, Fitbit Sense 2, machines disguised as accessories, capable of ECGs, oxygen saturation tracking, sleep dissection, and subtle shifts in skin temperature. Fitness trackers like Whoop and Garmin whisper insights about stress and recovery. Smart rings such as Oura and Ultrahuman read the silent language of heart rate variability. And continuous glucose monitors like Dexcom G7 and Libre 3 let users watch their blood sugar dance in real time, turning invisible metabolic chaos into readable data. Once expensive, specialized equipment, now quietly worn by millions.
Regulatory bodies generally consider these devices safe. They emit non-ionizing, low-power signals when used as intended.
Regulatory bodies echo the same conclusion. Used as intended, they are safe companions. But even this isn't the final chapter. In research labs across the world, scientists are pushing diagnostics into realms that feel like science fiction.
Sensors reading biomarkers through sweat or skin, AI analyzing large datasets to flag patterns, though most such tools are still research stage. Microfluidic chips capable of running tests from a single droplet, a growing area of diagnostic research.
Miniaturization so advanced that the next diagnostic device might be embedded in clothing or woven into a contact lens. This is the rise of non-invasive diagnostics. Quiet, invisible, and astonishingly powerful. A future where the lab comes to you instead of you going to the lab. And yet, amidst all this progress, a whisper from the past remains. The legendary old-school physicians who could diagnose with a glance, who relied on instinct sharpened by decades of experience. They weren't wrong. Observation is still the foundation of good medicine.
Today, doctors use diagnostic tools not because instincts have weakened, but because modern tests can reveal what careful observation may miss.
Tests aren't a waste when they're purposeful. They're another layer of clarity, another light in the darkness.
The real concern isn't testing, it's over-testing, ordering tests without clear clinical reason or patient context.
When clinical skill and diagnostics work together, that's when medicine becomes its most powerful. So, how much should you rely on your wearable devices? Enough to understand your body's rhythms, to catch irregularities early, to see how sleep, stress, and food shape your internal world, but not so much that you mistake an alert for a diagnosis. These tools are your scouts, not your doctors. They raise flags, your physician interprets them. If something feels off, if your ring or watch shows a sudden anomaly, take it as a sign to investigate, not to panic. In the end, the mystery of modern healthcare isn't about choosing between tests or technology, old wisdom or new innovation.
Blood tests, scans, and diagnostics remain valuable, potentially life-saving when ordered with clear clinical purpose. Wearables can offer a helpful layer of self-awareness, a non-invasive way to track your personal health patterns.
Wearables offer a new layer of self-awareness, a non-invasive window into your internal landscape. And you, the patient, stand at the center of it all, not a passive recipient, but an active participant in your own health story. The key is asking questions, keeping records, seeking clarity, and embracing technology without surrendering common sense. Because the future of healthcare isn't in needles or machines or even AI. It's in empowerment, in choosing the right tests, understanding the reasons behind them, and using the silent signals from your own body to guide your decisions. In this unfolding medical mystery, knowledge isn't just power, it's protection.
This video is for educational and informational purposes only and does not constitute medical advice. Always seek the advice of a qualified healthcare provider regarding any medical condition or treatment.